regarding two requests I have pending before your department. Right now, at least 2.5 million adolescents suffer from substance abuse disorders, and surveys sponsored by your department show continued and increasing trends of the abuse of prescription drugs like Vicodin, Xanax, and in my opinion, the very powerful and deadly OxyContin. This problem has been largely ignored in the healthcare reform debate. I have concerns that proposed generalized programs like the Prepared Communities Program and counterparts at the DOE will dilute the important focus on drug addiction and prevention. So my question for you, my first question is, will you ensure that a clear focus remains on strategies aimed at directly preventing drug use and underage drinking?
I look forward to working with you on that, absolutely.
Thank you. Last year, I asked the FDA, late last year, some specific questions regarding a new formulation, which, from what I'm hearing, is it is not tamper-proof. Actually, it might allow the drug to be OxyContin to be even more abused. So I wrote the letter to the FDA with these specific questions. And so, given the tragic abuse of prescription drugs among our nation's youth, I'm hopeful you can encourage your staff to respond to this inquiry.
I'd be very happy to do that. And Congresswoman, I would like to also have our new director of the Substance Abuse and Mental Health Administration get in touch with you. As you probably know, substance abuse with prescription drugs is only slightly behind alcohol abuse right now and rising dramatically among children. It's an issue that she takes very seriously, has done a lot of work on. We're using her to help inform a number of our outreach and strategy efforts. So again, I think it's going to be a renewed and specific emphasis throughout our department.
I'm encouraged to hear that, and I thank you. I think it is very, very important for us to do that. Finally, I request your assistance with an issue that's important to our shared goal of rooting out waste, fraud, and abuse. In my district, the 45th District of California, a tribal TANF program is operating, and the tribe has received over $30 million a year on average to administer this program. It is troubling that government audits have shown a repeated misuse of federal taxpayer dollars, including federal allegations of misuse of $6 million alone in 2002 and 2003. Years later, penalties assessed to the program have still not been resolved. I recently requested that the IG at HHS and ACF investigate this matter further. The IG stated that the concerns would be best addressed by ACF. Knowing the charge of the IG's office, I hope that they and the ACF can aggressively seek answers and come to a resolution as to what happens, what appears to be years of insufficient accounting and wasteful use of taxpayer dollars. I fear that prolonging this problem only hurts the Native Americans for which the program was designed to serve in this difficult economy. Are you willing to consider protecting taxpayer dollars by withholding new funds until the situation can be resolved?
Well, Congresswoman, I must confess I'm not aware of this situation, but I will commit to going back and dealing with both head of ACF and the IG's office and putting together the information. I can't commit to anything until I know what the situation is and what the history is, but I will definitely take that as a personal commitment.
Thank you very much. I think it's extremely important. It is a very blatant example of this waste, fraud, and abuse, and it is hurting the people that are designed to be helped by this kind of a program. So lastly, I'm sorry that my colleague from California left, Ms. Eshu. I just would like to say that her questions about what has happened in the past on health care really ring hollow to my constituents. They care about what's happening today, and I can tell you that they do not like the government takeover of health care in any way, shape, or form. So I'm sorry that she's left, but I did need to say my frustration as well is pointing the finger. My constituents are tired of that argument. They want to hear that they want to have answers, and government takeover of health care is not what they want to hear. So I appreciate your being here today, and I look forward to working with you in the future.
Yes.
I yield back the balance of my time.
Thank you. Next is the gentlewoman from Illinois, Ms. Schakowsky.